Before you schedule that spinal fusion, stop and watch this. The Lown Institute analyzed recent Medicare data and found that over 200,000 unnecessary spine surgeries in just 3 years. Half of all lumbar fusions fail long-term. And once you put metal, rods, and screws, this is permanent. It's forever. So, I understand why many surgeons perform them. It's what many were trained to do. It's the only tool they have. But I also see the other side. Patients who come to me after a fusion that didn't fix their pain or even made it worse. Even Dr. Eugene Carrigy, my former colleague at Stanford and a respected spine surgeon, called out the overuse of fusion procedures and was alienated for it because he dared to question the big money incentives driving the industry. Let's be clear. There are absolute times when surgery is the right call. A traumatic fracture, a tumor, an abscess or a hematoma that must be evacuated, or true neurosurgical emergencies like loss of bowel, bladder, or erectile function. These are red alert situations. But for the vast majority, mild herniations, spinal stenosis, degenerative disc disease, there are non-operative paths that can truly restore function. The most common and most lucrative spinal procedure in the U.S. is fusion. Here's the problem. When you fuse one segment, you overload the one above and the one below. That extra stress across these extra joints above and below accelerates the arthritis, creates new pain, and sets you up for the next surgery, then the next surgery, then the next surgery. Revision surgeries pay more than the primary surgery, but they also leave patients chasing relief that keeps slipping further away. This is why I built the Tower of Power Spine program. It's designed for those 80% of patients who don't need the operating room. We focus on functional spinal unit, the discs, the joints, the ligaments, the muscles, the fascia, these things that actually make you move. We use precise orthobiologics like PRP and bone marrow aspirate concentrate to support tissue healing. We employ FDA-authorized neuromuscular technology to reactivate and strengthen your core and those deep stabilizing muscles. We optimize labs, amino acids, protein, micronutrients, the same surgical grade optimization you'd want before any operation. We integrate prehab, postural retraining, and functional movement to make your spine support you again. This is not a one-injection fix. It's a comprehensive system to restore motion and stability. Take Larry. Over a decade of back pain, told by multiple surgeons, fusion's your only option. Instead, he went through a structured 2-month Tower of Power program, targeted core activation, nutritional optimization, ultimately biologic treatment using its own bone marrow aspirate concentrate. 6 weeks into the 8-week process, he said, for the first time in over 10 years, I can move without severe pain. That is the power of function-first medicine. If you've been told fusion is your only answer, get another opinion, preferably from someone who treats motion, not just anatomy. Explore the Tower of Power Spine program at Precision Regenerative Medicine. And if you're just starting your journey, begin with my Restore in 5-day challenge. It's the foundation for rebuilding muscle, metabolism, and mobility safely. A fusion is forever. Knowledge and the right strategy can keep you out of the operating room. I'm Dr. Tammy Penhollow. If you found this valuable, hit subscribe. Share it with somebody who's been told they need spine surgery because most don't. Let's restore motion and protect your spine the right way.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.